How does genetic testing impact high-risk colorectal cancer screening? Genetic testing plays a crucial role in shaping how we screen for colorectal cancer in people at high risk. It helps identify inherited gene mutations that increase the chance of developing this cancer. When these mutations are found, doctors can create personalized screening plans that start earlier and happen more often than standard guidelines for average-risk individuals. This means some people might begin screening in their early 20s or even younger if there is a family history of early cancer. For example, if someone carries mutations like Lynch syndrome, screening might involve colonoscopies every 1 to 2 years, starting in their 20s or early 30s. This is much more frequent than the typical 10-year interval recommended for average-risk people. Genetic testing can also detect hereditary cancer syndromes, such as Lynch syndrome, which is the most common inherited form linked to colorectal cancer. About 10 to 16% of colorectal cancer patients have these high-risk gene variants. Identifying these mutations confirms a hereditary risk, which influences screening recommendations and preventive strategies. Besides colonoscopy, high-risk individuals may also need additional tests, like upper gastrointestinal endoscopy, to look for other cancers associated with their genetic syndromes. Current guidelines recommend genetic testing for all colorectal cancer patients under 50 and for those whose tumors show mismatch, repair deficiency, or microsatellite instability, markers linked to Lynch syndrome. This helps catch more high-risk individuals early and allows for tailored screening plans. The results also help assess risk for family members. If relatives carry the same mutation, they can start screening early and more frequently, while those without the mutation can follow standard screening schedules. Knowing a person's genetic status can also guide preventive measures, such as preventive surgery or medications that reduce cancer risk. It can even influence treatment options, especially if the tumor has specific genetic features. Overall, genetic testing transforms colorectal cancer screening from a one-size-fits-all approach into a personalized plan based on inherited risk. This approach aims to catch cancers early, prevent them when possible, and improve outcomes for those at high risk. If you have a family history or early-onset colorectal cancer, discussing genetic counseling and testing with your healthcare provider is a smart step to optimize your screening and prevention strategies.